Welcome, everybody. We're gonna dim the music a little and get you started on some logistics. Welcome. A couple of housekeeping logistics before I introduce myself and others on the call. You are on a video that's being recorded. Everyone has entered on mute to aid with the presentation today and throughout the event. Please do put your questions in the chat and I will be reading them out during our Q&A portion, which is a substantial part of the agenda today. If you are the only one on the phone, if you are only on your phone, you may text your questions to 202-550-9076. Again, that number is 202-550-9076. We'd like to be able to let the speakers know your name and media outlet, so if you could click on the 3 dots in the upper right-hand corner of your video box, you will get the option to rename yourself so that you can list your name and media outlet. And thank you, that'll help us in our response to all of you today. And thank you so much for being here. Welcome everybody. Thank you for being here and for caring about Black issues and Black communities. Some of you, I understand, were at our last reporter roundtable on post-COVID-19 housing solutions. We welcome you and appreciate you for being back with us here today. I am Melissa Jones, Executive Director of BARHII. BARHII, as you know, is the coalition of the Bay Area's public health departments, founded specifically to advance health equity by creating the communities we need to keep us healthy and sustain health. Until 4 months ago, many people across the Bay Area didn't know what governmental public health departments did. But in the last 4 months, the world has seen the value of public health's work to keep us safe and healthy. Public health departments focus on prevention, and so often the value of prevention is hidden because we prevent what otherwise would have been a crisis. And it's only when you prevent a crisis and then you see others slide into it that you know just how effective you were, and when people really can understand and appreciate the work that you do. And over the last 4 months, shelter at home has really been the perfect example of that work. We see the value of the prevention of that activity because communities that didn't use this intervention or who reopened very quickly have in many cases, hospitals that are at capacity or overrun. And we've started to see now the cases of patients being airlifted, for example, to the Bay Area for the support that they need because we still have our capacity here. And the decision even before the Memorial Day reopening surge, California's actions were really effective, and it meant that we were able to share supplies and needed materials with places like New York because we didn't have the surges that we were seeing there. And we can share with you the projections of what that's meant for lives here in the Bay Area, and really bring it up today to talk about how much leadership matters. And the choice to shut down really mattered, and the choice for how fast to reopen really mattered for COVID-19. These choices were difficult and not easy, courageous in many cases, and I'm sure many of you have seen the reports and repercussions on health officers for the decisions that they've made. These reports remind us of the importance of bold leadership in the face of incredibly difficult odds. That leadership matters is no surprise, and in difficult circumstances, it is the way that we foresee and prevent the crises and help us build to better lives. Shelter in place is also a perfect example for the conversation today because shelter in place worked for the people who could stay home. The essential workers in grocery stores, working on the tractor trailers that ensure the food arrives to our grocery stores, working in the shipping companies or the ports, making sure masks and protective gear arrive, or driving buses to get essential workers to the places they need to be were not able to stay home. And they need carefully designed protections, and we need to consistently hold businesses accountable to help meet employee safety standards, particularly because we know that essential workers are disproportionately African American. BARHII, as a coalition, a Black-led coalition through myself and our 2 board chairs, have developed a 4-part framework for an equitable response and recovery from COVID-19 that prioritizes essential workers and can help guide us to a pro-Black, pro-health agenda for the Bay Area. This framework is included in your packets. I'll share the 4 points today before I talk about the incredible speakers who are going to talk to you about the work already moving forward in the region. The first priority is to reopen safely through a series of worker protections for health and assigning equity officers to every COVID-19 emergency response center in the Bay Area to ensure particularly the issues of Black communities who are disproportionately impacted by COVID-19 and disproportionately dying from it have the strategies they need for that not to be true. 2, rebuilding family and business income. As African Americans, we've been hit hard through job loss, decreased hours that make pay unpredictable, and loss of business income. Our strategies must protect Black renters and homeowners through continued eviction moratoriums that currently cover 100% of the Bay Area, and ensuring foreclosure protection from foreclosure. We also need strategies that give commercial rent and connect more businesses commercial rent and connect more businesses to the resources they need to weather the uncertain reopening. 3rd, mental health supports and protections. The trauma that young people and families are experiencing now is complicating generations of trauma and financial uncertainty that Black families have been subjected to from unfair economic conditions over many years. And we'll talk a bit more about that today. And the last part of the platform that has been adopted by the Bay Area Public Health Departments to focus on an equitable recovery for the Bay Area is Plank 4. And this part of our recovery is the radical revisioning of our society to protect the health of people of color, particularly Black people across the Bay Area. BARHII has been building a specific Black health agenda because of the Herculean efforts that Black leadership pursue continue to be harmed by systemic racism. The leaders you will meet today have created opportunities for communities, Black communities, against incredible political and economic odds in order to support Black families, and they have prevented the depth of challenges that we could have seen from the tidal waves of skyrocketing housing costs, structural racism, and the bifurcating of our economy that has more people has the highest earning more and a shrinking middle class. Both inside and outside of our public systems, Black leaders are working hard against incredible odds. And Black leaders have moved mountains in the Bay Area, often with less financial resources and far less media visibility and access than other nonprofit organizations. And so we thank you for being here today to hear the stories of some of those organizations across the Bay. They have, Black organizations have operated both inside systems and out. Their visions for the future you'll hear today through leaders who will talk about the structures that they have worked through despite their efforts, and the stories that still need to be told. I'll close with one anecdote of the ways that we need to look differently at what's happening in the Bay Area. Throughout the region, we, community organizers across the region, worked on eviction moratoriums to ensure that in this incredible moment of financial decline, no family was newly homeless. During the City Council and Board of Supervisor meetings all across the state that happened on this topic, the pressure to reopen golf courses was heard at the same time as people of color's fight for eviction moratoriums. In counties, including right here in the very progressive Bay Area, residents and activists sat in those same meetings for 30 to 40 minutes, waiting for the issue of the golf courses to be heard before they were able to speak on their agenda item for eviction moratoriums. We didn't see articles that noted that juxtaposition, but it's an important one. And I'm really happy to have reporters here today who can help note stories like that and help note what it means about who gets heard and who gets prioritized in the public sphere. And so I appreciate you being here today. We have more information about the COVID-19 recovery platform from the Bay Area's public health departments. And I am here to introduce you to Darius Young, also from BARHII, who will introduce you to the incredible speakers we have today, to talk both about their successes and needs across the Bay Area for an equitable pro-Black COVID-19 recovery. I'll just remind everybody that you're muted, so when it's your chance, you'll need to unmute.
So good afternoon, everyone. And it's my pleasure to be able to introduce to you not only dynamic speakers, but community activists, organizers, and policymakers. These individuals have been active in their work, trying to make equity a thing, even prior to COVID-19 and all the other things that we have experienced throughout this spring and summer. So as I introduce the panelists, when I call your name and give your introduction, just kind of hit your reactions by just giving a little wave. So I'd first like to introduce to you Mr. Keith Brown. He's Oakland Educational Association. Keith is a teachers union and has made waves in their successful organizing to get the police out of the Oakland Unified School District. Keith will focus on the union's work to ensure safe conditions for workers, children, and families. So give a thumbs up for our brother Keith. I'd also like to introduce to you someone, his name is Shamari Carter. He is a great individual. He was once the aide of one of our best supervisors in Alameda County, which is Keith Carson. He is now the executive director of OCUR, and Shamari will cover how Black businesses are doing during the shutdown, unequal access to the recovery funding, OCUR's Black Business Relief Fund, and their work building trust and mutual support among businesses and Black communities. Let's give a thumbs up. Next, I would like to introduce Nikki Beasley. Nikki is the executive director for Richmond Neighborhood Housing Services. Nikki's focus is on housing and Richmond families and how communities are working to address displacement, increase Black home ownership, and tackle what may happen as the COVID crisis intensifies, especially during the racial wealth gaps. The next person I'd like to introduce is Ms. Rhonda Renfro. Rhonda is the executive director of Club Stride. Club Stride is in Solano County and they operate out of Vallejo. Rhonda will focus on youth organizing and youth leadership in Vallejo, especially Club Stride's efforts to address police violence. She will highlight youth participation in current marches, past work on the police use of force bill, and conditions in Vallejo, which has been the site of a number of police shootings, including the last shooting that just occurred during the George Floyd protest. Next, I would like to introduce John Jones. John Jones is not only he's received numerous awards for his organizing and advocacy efforts. As a matter of fact, in 2016, he was named as a dynamo for justice. And so that's John Jones. Just a little bit about John. He is currently the director of community political engagement for Just Cities. John will speak on efforts to eliminate the discrimination that incarcerated people face in finding housing, especially people released during COVID-19 but locked out. And John will also, because he's been working closely on the ground with the issues that are connected with the overgrowing pandemic, state of emergency at San Quentin, he will also be the voice of those voiceless individuals who could not be on this panel. And next, we will introduce Miss Yvonne Williams. Yvonne is the president of ATU 192 Union, and she will focus on protections for critical essential workers, bus drivers in Alameda and Contra Costa County, and the public during COVID-19 and as we recover. So let's give a thumbs up in our chat box and a clap for our panelists, and let's get this great event started so we can be informed of all the things that are going on, and so how we could react. And we just so grateful to have the press here. So let's get this moving. We will start with our first person. Let's start with Mr. Keith Jones.
So I think I'll start as Keith Brown.
My mistake.
No, it's all good. Yes, I'm Keith Brown. I'm a teacher at Bret Harte Middle School in Oakland, and I'm released as president of the Oakland Education Association. This is my second term as president of the Oakland Education Association. I'm the first Black male in the nearly 100 years of the organization to be president, and we represent the teachers of Oakland, librarians, nurses, psychologists, social workers, therapists, nearly 28,000 members working in service of our students in the Oakland Unified School District. And I think a lot of folks really began to be familiar with the issues facing our students during the Oakland teacher strike last February 2019, where we really highlighted the lack of student supports for our students in Oakland. And I just want to start out by saying the failure to fully fund our schools in Oakland at the level that our students deserve is a racial justice issue in a district overwhelmingly serving students of color. And that's some of the things that we highlighted during the strike as a racial justice issue. Looking at some of the things that our students need because of the COVID pandemic, a lot of these things was needed before the COVID pandemic, as far as our students in the flatlands, our Black students having access to clean restroom facilities, having access to safe classrooms with air filter systems, having smaller class size. So we're hearing a lot of these things are needed in our schools because of the COVID pandemic to make sure that our students are safe. These are things that our students deserve way before the pandemic. Our Black families have been disproportionately hit the hardest because of the COVID-19 pandemic and this economic crisis. Decades of disinvestment of our Black students and the criminalization of our youth has led to a school to prison pipeline in the Oakland Unified School District. So during this time that we're in is basically a crisis of COVID, racism, and economics. And during this COVID crisis, just seeing the imagery that went around worldwide of the state killing of George Floyd really showed the need to affirm and protect Black lives. And in this moment, the Oakland teachers, we worked with the Black Organizing Project in Oakland, following the lead of the Black organizers who for more than 9 years have been working on a campaign to eliminate the police from the Oakland Unified School District. So following their lead, the teachers of Oakland, we signed a petition supporting the Black Organizing Project's George Floyd resolution. Over 1,000 of our members signed that petition. Our members created videos. We supported the Black Organizing Project and students in marches and rallies. And it's taking the lead as a union, as educators, as far as following the lead from the community organizers is how you are able to win campaigns. And the pressure from this coalition forced the Oakland Unified School District to finally pass the resolution where the Oakland, the OUSD police force is removed from our schools, and that funding now will be going to things that our students deserve, such as mental health services, restorative justice programs. And this is what we need to ensure the safety of our students. We need healing informed practices to create a safe school environment for our students and to really help our students navigate through the school system, not punitive measures that increase the school to prison pipeline. Also, in this current time that we're in, we want to make sure that when our students begin the new school year, that we have our students safe. And we need to prioritize resources for our schools that serve Black students. So we need to make sure that there's criteria in place to ensure a safe opening at in our schools, making sure that there's reduced community transmission of COVID-19 cases, and making sure that if we have to go back into a distant learning model, which I call a crisis learning model, which for many of our families, particularly our Black families, have not been served, but we need to make sure that our families have access to the technology, internet hotspots, that there's counseling available for our students, mental health services, and also it's not just about serving the students, but ensuring that our families are protected with, with a safety net, to make sure that that our families are protected from evictions, that they have access to health care, and also that there's an income protection for our families. So I'm just going to close by saying that this pandemic, it really showed the importance of schools for our communities. It's a social hub providing not only education, but services such as food, nutrition, health clinics. So we need to make sure that we have investments in our students, and that we center and prioritize our Black students in Oakland.
Thank you very much, Keith, for the very insightful information. Our next guest we will introduce is Rhonda Renfro from Club Stride. Rhonda, take it away. You're on mute. Unmuted.
Okay. Hi, everybody. My name is Dr. Rhonda Renfro. I am the executive director and founder of Club Stride Incorporated, which is a youth empowerment organization located in Vallejo, California, that drives equity-centered youth action to create a civic capital that cultivates healthy, vibrant, and resilient communities. Our job as a nonprofit, as a business, we're in the business of giving youth voice. And even in the midst of this COVID crisis, we have continued to do that. We have moved our programs and our services to a remote platforms that continue to allow our young activists to meet, to exercise their power, exercise their voice, and to lead organized efforts. For example, I'm really excited and very proud of a project that they're currently working on. The Strategy to Empower Impacted Families project, where they're working directly with members of family members who have been impacted by police violence, because they understand that the importance of being heard, and they're using their advocacy, they're using their social media expertise to elevate the voice of impacted families. Because they understand not just how much this will impact them and empower them, but they understand that by doing so, they're actually providing a platform for them to empower the impacted families. So we're very excited about that campaign. This is how we galvanize community-led social justice efforts to improve equity in the city of Vallejo. This is really how we take part in transforming our society, and also methodically breaking down institutional racism. Today in the city of Vallejo, African American people face life and death situations, and those situations require a vision, a leadership vision that will promote collective healing reconciliation, peace, and trust. But the city of Vallejo, the city government, continues to support strategies and policies that promote structures of inequality or inequity and racism. And these policies continue to deepen the devastating health impacts of COVID-19 disparities in our most devastated or vulnerable communities. So Club Stride is building a collaborative partnership with a diverse cross-section of community members, which includes youth organizers, advocacy groups, and community-based organizations to focus on accelerating and strengthening the impact of equity-centered strategies for promoting safety and healing for all Vallejo communities. So this is what we are doing in the city of Vallejo. We have upcoming on July 28th, an event which we intend to kick off resolution-driven action toward healing. Vallejo is a city that needs to heal. There's been a lot of trauma that has happened in connection with police brutality. And this demonstration, we're calling the Red Light Demonstration. It's going to be a virtual event. And the focus of the event is to challenge false narrative around defunding police law enforcement. And the young people who are actually organizing this event, they also want to protest efforts by the city of Vallejo to increase funding for law enforcement, while they seemingly are blatantly ignoring the issues of mental health that will continue to persist and perpetuate if they do so. So yeah, that's what we're doing in July. We want to also, we're going to be reaching out to entertainers and poets and speakers who are part of the revolution that has been started by young people who understand the movement of the Black Lives Matter movement and who want to help inspire and support Vallejo youth at this event. We need to shed light on the existing issues of inequality in the city of Vallejo, and this is our way of doing it. Also, for people who want to be involved in what we're doing, they can join Club Stride. Our telephone number is 707-731-2726. Thanks.
Thank you. So I'd like to call up our next panelist, Shamari Carter from Occur. Thank you.
Thank you, Darius. Good afternoon, everyone. My name is Shamari Carter. I'm the executive director of Occur. Occur is a community building organization, and we have 3 pillars: civic engagement, education and technical assistance, and economic development. Now we've been engaging in new solutions to old problems that have been exacerbated by COVID-19 and civil unrest and all the economic instability. We are maintaining our technical assistance through Zoom and through online measures for both businesses, faith organizations, and other nonprofits. We have started a Black Business Relief Fund, and this relief fund was started to create or to minimize the barriers to funding. We saw that there always been a lot of barriers to funding, and they were again exacerbated during COVID-19 and during civil unrest. So we wanted to create a fund that minimizes those barriers, and the barriers that we saw is access, logistical issues, and timing and the speed of funding, being able to have a rapid relief fund and something that can be issued in a short amount of time with the least amount of paperwork. And it wasn't just about giving funds for us, it was also about creating mutual support and doing some community building through economic development. And so we did issue some direct mini grants, but a lot of our work has been to connect supporting businesses. So we have a business that does branding. And so we have purchased vouchers for other businesses to use those branding services as part of our Black Business Relief. And we've also been focused on making sure that we put those businesses back to work. A lot of the businesses want to go to work. It's just not, it's one thing to get funding, but it's one thing to put these businesses back to work and having some activity. So every Tuesday and Thursday at our technology center, the David E. Glover Technology Center, we have a community pop-up where it's mainly food distribution, but we also accept other donations, and we give out masks. So when we first began, we purchased 100 masks from an Oakland company that started producing masks in order to supplement their income. And so we purchased those masks to give away to the community. And we've since been able to source other masks to keep that business going. And so that the community knows that we have a business that can produce these type of things. We've done other things through that community pop-up. Like 2 weeks ago, an Oakland-based business, Pound Business, we decided we're going to buy 500 slices of pound cake to go along with the 500 meals that we issue out every day. And we issued out those meals, and it was a great experience for the community. It was a great experience for that business, and it was also effort in community building and letting community see once again the businesses that we have in our community and that we are sustainable. We had an event, I believe it was 2 weeks ago now. It was a Deep East Oakland Rising, where it was a rally, a march, and a festival. And so our main concern was in the Black Joy Festival, where we brought together 3 different catering companies. We brought together a Black sound company. We brought together a Black security company. And we brought together our local clinics to be able to provide health education and provide a community building outlet for the residents of Deep East Oakland, especially the residents that feel like they are not a part of some of the protests and have a voice otherwise in other parts of the city. So we wanted to make sure that that voice was created while also promoting our businesses. And once again, just everyone being able to market and see and be able to participate in economic development in the community. And so that's the big highlight of our COVID and civil unrest, as I call it, outreach efforts. Thank you.
Thank you. I'd like to next call up our next panelist, Yvonne Williams from the ATU 192 Union. Did you?
Yeah, hi everyone. Good to be here. My name is Yvonne Williams, and I'm the President Business Agent of the Amalgamated Transit Union Local 192. We're chartered right here in Oakland, California in 1901. And since 1901, we have been providing transportation services to our most vulnerable and needy community, to the children who have to go to the public schools and private schools, to folks that need to get to work if they're going to a grocery store and anywhere that they may need to go in order to provide for their families. We've been providing that transportation piece. We represent about 1,700 members in Alameda, Contra Costa, and Solano counties. We represent bus drivers, mechanics, allied trades, janitors, service employees, and clerical workers. In order for me to really frame what I want to say to you today about what we see in our communities as we traverse the streets, I have to bring you back to 1980 through 1990, when the crack epidemic started to devastate our communities. What we saw is young children as young as 7 years old with their siblings that could be as young as 3 years old. 1 o'clock in the morning, seeking transportation, trying to get back to their communities, whether it was Acorn or or East Oakland, or wherever they needed to go. The transit operators at that time refused to call the Child Protective Services because we knew that our Black babies would only end up in a system that would harm them more than they were being harmed by being in the streets trying to get home at 1 or 2 o'clock in the morning. Now we're in this situation of COVID-19. And I'm here to speak to you about what we need to do to try to do something to curtail or contain the increase in the positive test that's devastating our community. As a transit worker for over 40 years, I can absolutely tell you what we need is to take the testing to where the people are. I think it's really, it's a doggone shame when people who do not have access to the internet connection and may not have access to other resources, may not even have the bus fare or transportation to get to where the testing sites are, that we're not thinking more broadly and either having a bus as a mobile transportation to get to where we need to test our people and make sure it's not a requirement for them to be recommended for the test by anybody, just to show up, have the test. And also, we should not be requiring our homeless population, our needy population, to have an identification or any other means in order to be provided with the COVID-19 test. What we've done at ATU and other ATU properties is when the CARES Act funds were first distributed in the Bay Area, we contacted the Metropolitan Transportation Commission. We asked the Metropolitan Transportation Commission to provide essential protections for our workers. We asked for PPEs for all transit workers, including masks, gloves, disinfecting wipes, hand sanitizers, and plexiglass dividers on vehicles to protect transit drivers. We asked for masks for every rider who needs one to protect riders and drivers in the larger community. We asked for disinfecting of all transit vehicles to state-of-the-art standards on virus protection, including hiring new workers, training them in state-of-the-art sanitation methods, and outfitting them with hazard suits, N95 masks, gloves, and goggles. We asked for hazard pay for our heroic transit workers. We asked to recover the fares, for recovery of the fares that have been lost by rear door boarding. We also asked to meet specific needs of especially vulnerable populations, including people with disabilities, seniors, and paratransit. What the Metropolitan Transportation Commission did was they decided to disperse the funds based on a pre-pandemic formula, which did not address the items that I just listed. We continue to advocate for those items. The Metropolitan Transportation Commission, they formed a Blue Ribbon Task Force. Jim Lindsay, our ATU International Vice President, was on the Blue Ribbon Task Force. He could not and would not agree with their recommendations because they didn't address the aforementioned issues. The Metropolitan Transportation Commission wants to leave the decision to the employers of the transit agencies to make a decision on how best to protect the riding public and the transit workers. We're asking the Metropolitan Transportation to show leadership at this time and stand up and set aside some of the CARES Act funding specifically to make sure that the items that I previously mentioned are provided for and mandated. This situation that we are currently in now is completely devastating to the Black community. There is no doubt about it. There's stats out there that explain our exposure compared to other communities. Right now, we are like 2/3, I believe, of the a positive test and a higher number of those who died, even within our own ATU international and transportation systems. So, I believe that we can lift up this situation. I'm so glad to be on this panel with such great panelists, such great speakers, and people that I am ashamed to say, I didn't know your work, but I do now, and I value you. I value you. So we're going to continue to push to make sure that every rider has a mask if they need one, that there's sanitizers on each bus or transportation vehicle, that these vehicles are sanitized at the end of every line so that when our public gets on the bus, they can be confident that we're doing everything we can to protect their safety. We don't need our riders and our workers becoming ill, which they are, and then transporting this virus home to their families and their loved ones. And so that is what we're working on. And I just thank you for allowing me to join. I hope I've covered most of the areas that, and maybe some others that I was asked to cover. Thank you.
Thank you. Thank you. I'd like to introduce our next panelist, Ms. Nikki Beasley, Executive Director from the Richmond Neighborhood Housing Services.
Well, thank you. Thanks everyone for providing this platform. Leading the Richmond Neighborhood Housing Services, we are an organization that's been around since 1981, providing housing to low to moderate income families. We've transitioned to a full-blown affordable housing organization, and our focus points are we're property managers of single-family homes that we rent to low to moderate income families. We are a HUD certified counseling agency that provides the financial education related to home ownership, but also protecting individuals that are at risk of foreclosure. We also are infield developers building home ownership opportunities for first-time home buyers. And lastly, we do a lot of advocacy as it relates to consumer affairs and tenant rights and consumer affairs specific to CRA, which is a catalyst, Community Reinvestment Act, a catalyst to a lot of the issues that we find that are keeping, Black folks from being able to participate in the economy. So I have to say, when COVID hit, we took a moment. We were not reactionary because I really needed to understand what our role and place would be and how valuable of a voice we would have to address the needs of the community, and really trying to quickly assess what the needs were. So we created a rapid response fund to support single family or single parent households with minor children and seniors to provide stipends for utility and food. We've also ramped up our educational series, which is our pre-purchase workshop and Money Matters series, got them all on the virtual platform. And our feeling was that we had to keep people encouraged, keep people focused on the overarching goals that they had financially. And not that we went to business as usual, but really kind of created the sense of urgency, understanding that many would say that in crisis, they find opportunities. And as you've heard, in our crisis in Black communities, we don't tend to excel. So that's really been our mission, that if homeownership is still a platform, we have a tagline that says changing the narrative of home ownership. So prior to COVID, people felt that you couldn't get into a home without 700 credit score, 20% down. We have demystified that myth. And post-COVID, or during COVID, people's concern of what's going to happen in real estate, is this a good time? And we believe that ownership is a catalyst to all other things happening to support the security of a family. So that's really been our call to action, the getting funds to support families, as well as keeping people targeted on their overall goals. I would say that the needs are this. What everyone is starting to understand, we as Black people have been living this experience for our lifetime. But I believe as Black leaders, this is our opportunity because the momentum, the focus, the attention, the words and the conversation have not been as colorful as they've been now, where we now can walk into rooms and not be feeling a certain kind of way. We say Black compared to people of color. And from a media standpoint, if you truly want to get to the crux and the root of this, you too being comfortable to say this is a Black issue, not a person of color issue. If you want to get to the root of it, do the landscape lens of understanding the why, which then is the breadcrumbs to all of the systematic racism that now people are getting very comfortable to talk about. But as we get to those breadcrumbs, having to dismantle, the conversations are now the oppressed can't, influence the oppressor. So we don't have the keys to the kingdom. We can, are very clear of what needs to happen in these infrastructures, but we really don't have the power or the influence, because many times, and I'll speak for myself, but probably the same for many leaders, a lot of these conversations are tolerated in these type of sessions. What do you need? We're poked, we're prod, we're surveyed, we get the data, it creates a great report, but not much happens from that. So with all that's happening now, it's critically important that we leverage this momentum and dismantle some of, the conversations, and I'll stay specific to housing, and I have to thank Miss Melissa Jones. She taught me something a few months back at a meeting of uncoupling income, not assuming that all Black people are poor, which brings us to the housing component, that much of the subsidies that are available are for low to very low income levels. And there was an aha moment for me, because there's an assumption, because when we say community, that's a code word for people of color, Black. But when we talk about individuals that are, working class or the missing middle, that tends to be in area median incomes that exceed 100%, they're assumed to be making, good money, so they don't need any support. But and this is where that landscape lens becomes critically important in this type of conversation, that as an African-American Black person making, let's say, $120,000 sounds really good on paper, but they do not have the wealth generation of dad, grandparent, uncle, cousin that can assist with a down payment to get into a property, that could assist that if they did get a unwarranted eviction, that they could get money for, the resources to help get into the next unit. And that what doesn't tend to get talked about is, from an African-American standpoint, we are at the lowest level on any metrics, whether it be employment, health, ownership, wealth, you name it, we're at the bottom. But the one area that we're at the height is education. And with that education comes debt. So when a person is making quote unquote good money, but they also have $100,000 to $150,000 worth of student debt, that destroys their disposable income to really move and navigate. So my closing words would be that as reporters, when you're having these conversations, there needs to be a deeper dive, because we can't continue to get comfortable with understanding the issue, but not trying to figure out where the problem is. And when we look at those influencers, if they're not decision makers at the table that look like the people that they are attempting to serve, that's problematic. Because again, this panel, and I think it's already been shared, can share a minimum of 5 or 10 things that could immediately drastically improve community, but we're not the ones able to turn on that lever to make it happen. So as our allies, opening up the door to make sure that we can sit down to ensure that these actionable items can take place, so that all this activity is not done in vain, but we can actually see some outcome of a moment like this really transitioning the communities in the way in which we want to see them.
Thank you very much, Nikki. And for our last speaker, we'll have John Jones of Just Cities, and then we'll jump right into our Q&A. Thank you very much.
Thank you. Good afternoon. I want to start by saying that I'm honored to be a part of this conversation, and I'm also honored to have a chance to listen to each and every one of the panelists. We are in a pivotal juncture in history. With that being said, my name is John Jones III. I'm on staff with Just Cities, where I serve as the Director of Community and Political Engagement. Just Cities is an organization that was founded by the late Honorable Roundtable, and he actually coined the name Just Cities because we're talking about justice. What we do essentially is two things. We advance racial justice by utilizing a transformative approach to policymaking. And what that means real quickly is, first of all, we organize those who are directly impacted by the issue. We believe those who are closest to the problems are also closest to the solutions. We value their experience and their expertise. And in a collaborative manner, we coordinate with other stakeholders in the community to craft a solution that's going to address the issues, not just currently from a reactive standpoint, but also incorporating the elements of historical context and institutional memory. I'm very pleased that Yvonne mentioned this, not just today, but yesterday as well. Oakland, that many of us knew, was sandwiched really between two pandemics, the first being crack, the second being COVID. Let me be clear, COVID-19 has not created anything new. What COVID-19 is doing is exacerbating the conditions that already existed from a systemic and institutional standpoint. So one of the things that we do is we educate folks on these issues. I'm someone that's formerly incarcerated. I am also the campaign director for the Alameda County Fair Chance Housing Coalition, where this year in January, we passed the strongest housing policy for formerly incarcerated people. And it's interesting because in a lot of ways it was prophetic, because the ordinance passed in Oakland in January, another one passed in Berkeley in February. And then we got hit with COVID and the shelter in place in March. So we know that over 1,000 people have been released from our county jails. We know thousands have been released from state prison, and we can fully anticipate that thousands more will be released. Here's the reality. Something I've been sharing for years. There's only one place in America any one of us is guaranteed a roof over our head, and that is in prison. I want to really think about that, because there is a clear connection and intersection between mass incarceration and this current housing crisis that we're experiencing here regionally. They are the result of policies and programs that were implemented decades ago. So for us, when we do the research and provide the education, it's important to give white supremacy and anti-Black racism a structure, give it a name, give it something that people can see that's accessible. So that way it's clear what we're fighting. A lot of times people use terms, but it's not fleshed out. So it's a gray area. Like when people say racism, you know, to me, there's a distinction between racism, which is systemic, and being prejudiced. You know, if I see a big scary dog or a dog that's scary to me, I'm prejudiced against that, you know, but racism is the power to institutionalize my prejudice. So we have to always segment the two, because I see this with policing issues, and there's a tendency to separate the police from the system. And as Dr. Huey Newton told us, the police is the instrument of the system. Police is short for policy. The police can only enforce what legislators enact. George Floyd was murdered because Minnesota was dealing with counterfeit money. And it was alleged that he was attempting to pass a counterfeit $20 bill. That store had a policy to where if that was to occur, to call the police. So we have to look at all the moving parts to these issues, because that leads us to where do we go from here? How do we really recover? How do we transform our society? How do we prioritize Black health? How do we prioritize the conditions that's happening in San Quentin in our state prison system? Because those conditions are mirrored in the quote unquote free world as well. It starts with transformation. And at the risk, I want to offer this biblical verse because it's so important, something I live by. Be not conformed to the patterns of this world, but be transformed by the renewing of your mind. See, the world is geared to be very reactive. Something that I shared that relates to George Floyd. I believe the reason why that situation was accessible to everybody, because first of all, we was dealing with COVID and shelter in place. So many people were home to actually see it. Let me be clear, he was not the first person killed by the police. And as we heard today, there were many more killed after him. We got to get out of what I call this predictive programming, to where something occurs and then people say, oh my God, this is happening for the first time. No, it has not. As someone that's a third generation Oakland resident, I want to remind people, the Black Panther Party for self-defense. None of this is new. What we have to do is come up with an approach that's going to incorporate the reality of all these moving parts. I call it the 4 R's. The first is reparations. Many people think of reparations as just receiving money. That's restitution, which is the second R. But reparations is repairing what is happening and has been happening for centuries. And it's similar to a doctor. In order to make sure that we're providing an effective cure, we have to make sure that we're also making the right diagnosis. I recall a situation to where the doctor incorrectly amputated the wrong foot because he didn't even read the chart to find out which foot should have been amputated. These things happen. We have to be educated. We have to educate ourselves. We have to educate each other, right? So restitution is receiving financial settlements, but reparation takes it a step further. It's the third R, rehabilitation. We hear this word, they added that to CDC. Now with CDCR, Department of Rehabilitation. The definition is to restore a person to their original condition. No one's being restored to their original condition, because when people come home, they're saddled with so many barriers. And this is why I've been pushing a real hard line as it relates to our people, our loved ones coming home. Yes, I don't want people incarcerated. And as someone that's formerly incarcerated, I was in prison during H1N1. So I know it's next to impossible to keep prison sanitized. It's next to impossible. It's too confined. It's too much shared space. But I always say this, when people say come home, what does that word mean? Do people even have a place to come home to? People was talking about shelter in place. Everyone don't even have a safe place to shelter in. A lot of our young people don't have a safe place to shelter in. So we've been pushing to ensure that, at least in Oakland and Berkeley, and we're trying to do this countywide. The next year we are anticipating to move this statewide, to ensure that when people do apply or want to move in with their family members, they don't have to mark that box. Now keep in mind, Alcatraz had a manual that they would give to everyone that came into that island prison. They said it was 4 things you were guaranteed when you were incarcerated in Alcatraz: access to housing, clothing, food, and medical attention. Everything else is a privilege. Why is housing guaranteed when you're incarcerated, but when you come home, it's not? Think about what that means from a standpoint of public safety and public health. Because I always share this, the will to survive is far stronger than the will to obey. We have to rehabilitate these systems. It's not enough to say, well, this was wrong, let's end that. We have to also address the harm that resulted from these policies. And we have to advance equity. You can't have an equitable society for 400 years and say, okay, well, today we want to play fair. No, that's not justice. That's not fairness. Last thing I want to add that's really key, and for me, we have to center the leadership of those who are impacted by the issues. Too many people treat this like an academic exercise. It's not academic. We have another saying, you don't know what you don't know. We have to incorporate the wisdom of those who are experiencing these issues. This is how we can turn this moment that we're in into a movement. The reason why there remain moments is because there's a tendency to forget. 3 months, the media was beating us upside the head with COVID-19, COVID-19, COVID-19. I was naming from the onset the things that I thought was problematic about that. People still gotta live, people gotta survive. Folks was telling me, no, just stay in the house, everything is okay. George Floyd was murdered. The same people are out in the streets protesting. Half of them not wearing masks, most of them no social distancing. I'm like, what is the difference? Oh, it's the difference because we have to address police brutality. I'm like, yes, but we can do both at the same time. Right? So at the end of the day, we have to make sure that what we're doing is not just perpetuating another moment. And I want to end this with this reminder from history, because institutional memory in historical context is everything. We all heard of the Montgomery bus boycott. The names we usually hear is Rosa Parks and Dr. Martin Luther King. No disrespect to those two, may they rest in power. But let me be clear, they was not the architects of that boycott. In fact, 9 months prior to Rosa being arrested was a 15-year-old Black girl named Claudette Colvin. Her name was on the original lawsuit. There were 5 Black women who were arrested. That lawsuit, they won that lawsuit, which led to them dismantling racial segregation in both Montgomery and Alabama. The reason why they did not want to utilize Claudette Colvin as a spokeswoman is because it was alleged that she became pregnant as a teenager by a married man. And they said, oh, that would give the game a quote unquote black eye. To me, that compounded harm and harm. This whole idea of respectability politics, that you don't matter, your experience don't matter because you don't fit some idea or image of what somebody else say. No, we do not replace systems with harm with systems of harm. We have to value our shared humanity. And that's why I always lift that story up, because the reason why that boycott was successful, 2 key reasons. It took the buy-in of those who actually rode the bus. At that time, in 1955, we're talking about predominantly Black women, because the only jobs really available to them at that time was as a cook, a nanny, or a maid. They had to take the bus from the Black community to the white community. The organizers didn't just go to them, and let me be clear, the organizers were Black women. They didn't just go and say, stop riding the bus. What they did was they created carpools. They made sure folks got to work and home safely. Now, can you imagine the conversations taking place when you're riding with somebody for 5, 6, and 7 days out the week? You're learning the names of each other's kids. You're learning things about them that you probably wouldn't have learned before. It's that deep relationship building that will translate and transform a moment into a movement. We don't see that now. It's professional organizing, right? They set up standards to where you have to have a college degree to even join some of these community-based organizations. That's insane. The people in Oakland are very sharp. We're very wise. But the difference today, if we don't go back to that deep relationship building, having a deep understanding of how all these systems come to play, we're just perpetuating the problem and setting up the next generation for failure. So at the end of the day, thank you. You got it. Because I get going.
Thank you. Thank you. And I want to make sure that people have a chance to ask you questions. So please chat in your questions. I have a set of 6 questions I'm going to get to. And I'm going to start. Thank you so much, John, for your comments. I'm going to start with Shamari. We have a number of questions about Black-owned businesses, and I'm going to read 3 of them to you for response at the same time. What do you make of the inequities we are seeing in business closures during COVID-19, in particular with Black businesses closing at more than twice the rate of white businesses? And also, what can we do about it? Related to that, how much of the initial support for Black businesses has continued, and how much is expected to be maintained? And then there's interest, of course, in how business owners can connect to your mini grants program.
I think I can go in reverse order and remember it all. So
Okay.
You can connect, business owners can connect through the Occur website, www.occurnow, OCCURNOW.org. We have a short form there, and then a staff member will follow up with you to get a better understanding of your needs. Like I said, it's just not about funding, but making sure that we fulfill needs so that businesses can stay open. It's about sustainability. You can also donate there on our website, occurnow.org, or you can go to GoFundMe, Black Business Relief Fund. Thank you for throwing that in the chat. The second question was about the
how much of the initial support for Black businesses has continued, and how much is expected to be maintained?
So that's a deeper question, and that goes into some of the deeper work that Occur is doing that I alluded to about community building. Really, that's a question of changing consumer behavior and making sure that we uplifting community businesses, which in the Black community, uplifting Black businesses so that people know that they're there, that they have the the support behind them, and the community uses them as such and sees the value in other Black businesses. I spoke about how we try to connect the businesses together. You know, we have a Black printing company, so Hamilton Signs, Broadway Hamilton Signs. So we make sure that we use that business, and we letting other businesses know, hey, this business is there. This is something else that we could use. So that's a part of a longer community building, consumer behavior question, and I expect it to continue. There are a lot of efforts. My Black Receipt, and we post businesses on our social media. Our handle on Instagram is Occur Now. Once again, OCCURNOW, and we post businesses several times a week where it's just a Black business highlight. Hey, this business is here. Marcus Books, the oldest continuous Black-owned bookstore this west of the Mississippi. Hey, it's here. You can order books here. This restaurant is here. This whether you're in the candles or tea, we have different businesses that we're highlighting all the time where you can be able to buy products. So I think those efforts will continue. And the first question was,
What do you make of the inequities we are seeing in business closures during COVID-19?
I think it's just an exasperation of what we've already been seeing and what was already in place. It's just highlighted, and it's a issue of access. We saw this issue with the Paycheck Protection Program, where certain banks, you had no one to call, and you had no one, if you didn't have a relationship, there was no way to process your application. And so with that, we're engaged in a number of efforts to bring Black-led or Black-owned, not just Black-led, because we have Black-led financial institutions in Oakland and the Bay Area, but Black-owned financial institutions, and having other resources like Black-led CDFIs, Community Development Financial Institutions, so that we can fund our businesses, so that we can fund development. Because like John spoke about, it's a lot of issues about place. When you talk about business, where can we have a business? Where can we have a sustainable business in our own communities? And so these are some of the efforts that we're engaging in to make these efforts sustainable.
Thank you. And thank you, John. I see you put additional information in about a resource for businesses along International.
Wow.
I'm going to go give on now to you on the transportation and essential workers questions. Have any operators or mechanics been tested positive for COVID-19? And also, has ATU made a statement on proposed transit cuts going before the board tonight?
Yes, we've had operators and mechanics that have tested positive for COVID-19, including some of their spouses that's also been impacted or also contracted the COVID-19 virus. AC Transit, in that regard, like other transit agencies, they intend to start collecting fares again, and the union's position on that is that until they have barriers in place, the plastic shields or barriers in place on the transit vehicles to help protect the workers, and until they have sanitizers on the coaches, masks available to the riding public, that it is not safe to roll back the protections that are in place. In regards to a statement about AC Transit's proposal tonight to cut some of the service, AC Transit, their position is that the service that they are cutting, particularly some of the San Francisco lines, is due to the decreased ridership. ATU is looking at that situation because we are well aware that before COVID-19, AC Transit was not able to hire and retain enough workers to provide the service that the public had expected. So we believe that this COVID-19 situation, it just empowers our AC Transit to make these cuts and put the situation on the decrease in ridership because of COVID-19, but they're probably at the level of service that they're able to provide even prior to COVID-19.
Great, thank you. And Keith, I'm going to go to you now. Some Oakland teachers have joined a campaign to refuse to return to work until there are no new cases in the county for at least 14 days. Does the union support this campaign, or do you have a similar position?
Oakland teachers, we want to educate our students when the school year begins, and we want the conditions of learning. We want our students to be safe, our community to be safe, and we also want that our students have a positive experience with learning, with all of the resources that we need. So in looking at face-to-face learning, physically returning to the schools, we're looking at two criteria. The first criteria is determining, is the risk low enough to return? And we know that in Alameda County, and particularly in Oakland, we have some high rates of COVID-19 in a lot of our neighborhoods serving our Black students. And the reason is because of systematic racism, of having the lack of access to quality health care. So we need to determine if the risk is low enough to return. And then the next criteria is to ensure that there are safety standards and precautions that can be met and maintained. So basically, if the first criteria is met, that we are confident that the risk is low enough to return, that the cases of COVID-19 spread are getting lower. And I think the 14-day, it's a good guideline. It comes from the CDC, but we just need to make sure that the risk is low for our students, because the main thing is that we want our students to be educated, have a quality education, but that they're safe and their families are safe. And also an important piece is that the educators of Oakland, we're working to advance common good demands to support our families, and that includes paid sick leave and family medical leave, making sure that there's rent and mortgage forgiveness. So these are the things that our families and parents need, because many of our families, they're the essential frontline workers. So we need to have a safety net to support our families also. So we're in talks, negotiations with the OUSD, Oakland Unified School District now, and we want to make sure that our students and families are safe. And if we are confident that we can return to the classroom, we want to make sure that there are safety standards. And it looks like we probably will need to continue with distance learning, just seeing the rates in Alameda County and Oakland. And we want to make sure that the experience with distant learning is a whole lot better for our students, that there's more access to technology, that our students also are able to interact with counselors and get the needed support.
Great, thank you, Keith. And that winds down our questions. I appreciate that we are 5 minutes over, but I think it's been an incredible conversation. And I know that many, many people are still on the line, so I want to invite you to raise your hand if you have an additional question for one of the panelists. If you raise your hand, Melanie from the team can unmute you so you can speak. We also would like to ask at this time, oh, I see a hand. Melanie, can you unmute the speaker?
Yeah, I'm unmuting. Thank you.
Okay.
Hey, peace, y'all. My name is Rashid Shabazz, and I manage the program Oakland Voices. And I'm interested in just understanding if you all are a part of some of the collective organizing Black folks are doing around COVID, particularly in Oakland. So I know that there was one group that was involved with the Black New Deal, and then I think there's been some other groups. And so I'm just interested to know if any of you are involved in some of that, and if some of those groups are coming together at this point.
And
I'm
we'll
sorry,
open that up
just
to
out
all
of
panelists.
respect. Yeah,
Yeah.
sorry. And then out of respect, hi, Miss Williams. Good to see you.
And likewise, haven't seen you in a while.
And let's open that up to all the panelists.
Yes, good question. I'm actually involved in several. I was one of the signees of the Black New Deal. I'm on the leadership team of the Oakland Frontline Healers, which has been dealing with the impact of COVID from the onset. And that consists of Black-led organizations doing things like whether it's feeding people in shelter, BOSS is a member with reentry, Roots, which has been doing a lot of testing, and even other groups that deal with issues that most people don't think has an impact, like sex trafficking.
Mm-hmm.
And then also I've been attending the meetings that the Brotherhood of Elders have been facilitating. So we understand the importance of different folks who are working seemingly in a silo just to come together, if not to pool our resources, at least to pool our understanding of the issues and our advocacy so we won't be set up to be pit one against another.
Okay, if you have a moment, I would like to chime in and say that ATU is involved with several constituency groups. They are not all Black. They're a coalition of transit folks that are interested in making sure that transit's provided to our communities, and we work very hard. And that the transit operators are the eyes of the community. As we transverse through the community, we see the devastation that's happening. The homeless population and the growing homeless villages all up and down East 14th Street and other areas. Those communities, and I'll say it again, if we need to have a bus, if we need to have some other means of getting to those communities to provide the COVID-19 testing, then I would be very interested in advocating that AC Transit and other transit agencies get involved if we can provide the transportation to get into the heart of those communities and actually say, yeah, we're here to help and we're going to provide you with the testing, no questions asked. All you have to do is call into a number or find a way to find the results of your test.
Thank you. And I see Nikki has added into the chat her connection to the Black Cultural Zone.
And I was going to put on something for Kerr as well. We're a member of the Cultural Zone, and where we're not direct members, we're supporting the organizations like the Frontline Healers. We've signed on in the last letter to the Board of Supervisors, the Black Cultural Zone, the Bay Area Empowerment Committee, where we support virtual workshop series around issues that are affecting the African American community, the Brotherhood of Elders, African American COVID-19 Rapid Response Group, and I think those are the officials, but like I said, we're always looking to support even when we don't have an official capacity.
And likewise, BARHII hosts meetings for public health departments across the region and has hosted the Brotherhood of Elders to talk about strategies that can be duplicated across the 9-county Bay Area. And Keith, I see a comment from you, and then I'm gonna ask our attendees what will be helpful in the next reporter roundtable. Yes, Keith.
Yeah, just quickly, I also participated in the Black New Deal, the Oakland Education Association has endorsed, and we're also a part of a coalition Justice for Oakland students made up of parent and student groups, and there's a Black work group of J4OS where we're involved in. And at this time, we're working on a campaign, reparations for Black students in OUSD, which will be coming out very, very soon, but just to address the needs of our Black students in the Oakland Unified School District to end anti-Black policies in our school district, and also to make sure that our Black families and students get the needed resources coming out of this COVID-19 recovery.
Thank you. And I'll close now with a question to Rhonda. And Rhonda, thank you so much for being here today. And we hear a lot of conversation about what's happening in Oakland, and we know that there's not as much reporting about what's happening in Solano County. And I'd love to just give you a final moment to speak about the importance of Solano and the importance of youth voice before we close out.
Sure, thank you. So yeah, Solano County is very different from Oakland. The present moment is particularly important for Solano County because Solano County does not have a history of organizing. The small organizations that are popping up recently that are trying to organize are actually kind of organizations that there's some connection to organizations in Alameda County. So what's happening in Vallejo in Solano County is very new. It's a very pro police county, and we basically have been working with the ACLU and the Let Us Live coalition around issues of police brutality. More recently, rolling out or implementing the police policy focused on AB 392, that codifies AB 392 that deals with police accountability. So these are all very new things that are happening in the city of Vallejo and in Solano County. And we're just looking forward to more. We're looking forward to supporting the young people who are on the front lines, who are making all of this happen, making this moment happen. You know, like they deserve to be recognized in this whole conversation. So I just want to put that out there, because without them, we wouldn't even be having these conversations. They are taking the real risk. Most of them are putting their lives on the line. And we have not seen this in a very long time. And we would be remiss if we did not do something now. This moment is extremely important.
Thank you, Rhonda. I'm going to close us here. I want to ask what would be helpful for future roundtable topics, and or what would be helpful in the future roundtable. We heard last time more time for Q&A, and so we've built that in the time now. Great, thank you, Rashid. Story ideas of correspondence. Great, thank you. Anything else that would be helpful, you can either raise your hand or chat into the box. And we will get information out to you about all of the things you heard about today, including the special events that are upcoming. So you can attend those events or talk directly to the panelists here or their colleagues. And thank you, everybody. Have a great rest of your day, and we'll be back in touch with you shortly. We'll send the contact information for the panelists, so you have it, JR. Thank you. Thank you, Laura. Thank you, Rashid. Thank you, everyone.